Okay, so, well, thank you everyone for attending this session. As you know me as Alessandro, I'm a research mentor in the ACORN team. In this session, this workshop is about clinical academic careers for nurses and midwives. We want to have a better understanding of what is research, what means have a clinical academic. So in a sort of say that it is on the tin, a clinical academic is someone embedded in the NHS, health and social care, and supporting, engaging, or undertaking research rather than academic nurses, researchers. So the aim is which alongside their designated clinical role, they conduct research that help to shape practice. And the NIHR suggests that a researcher immersed in a clinical setting is an excellent position to identify what research questions matter to the patient or service user, to the NHS, and to the profession. So they are also in a position to ensure that those questions are applicable in day-to-day practice and care, and to interpret and apply research findings in a practical and a useful way. So clinical academic roles are often joint appointments between healthcare providers and the higher education institution, in which both organizations support the post. So one organization typically hold the substantive contract of employment and with an honorary appointment in the other. So therefore bridging the bench of the bedside in a way. So a successful clinical academic will be able to demonstrate not only that they are an excellent researcher, but also that they can lead and inspire others in the clinical field. So what do we know about the benefits? This has been taken, this scheme has been taken by the, as you can see in the slide, through Southern and in 2019. Following a 10 years review by NIHR on clinical academic training programs. And it shows how, as a cascade, the impact of and benefit for clinical academic research for nurses and midwives and health allied health professional can impact from the individual level to the divisional level to trust and national and international level. What's behind the motivation? So most of this is taken from the RAND report, most of these elements. So were recommended in 2023 by the Healthcare Improvement Studies Institute to conduct a rapid review of the evidence based on the NIHR, on the NHS staff involvement with research. So the report considers what motivates NHS staff to contribute to research, how their involvement can be embedded and rewarded, and what the challenges will need to be addressed, and what we know about the impact of NHS staff involvement. So as you can see, some elements here, there is the opportunity to improve patient and staff experience and outcome, facilitates recruitment and retention, but also key element of impact and key elements of NMC code and part of the CQC well-led inspections, and also priority area for NIHR. So in the next slide, we want to think about why are there more than nurses and midwife research then? And this is a tricky question because it really depends how this has been embedded through the staff, clinical staff also. There has been about 20 years of UK research policies and paper seeking to drive clinical academic careers and engagement. And this is not enough time to run through a plotted history today, but why is that there aren't as leading research still? So about nurses, we really need to think what can have an impact and how can have an impact in our departmental level and the trust level about clinical researchers. So in the next figures, you can see the real challenges that we face. For a recent survey is showing that lack of time, funding, and skills are the first challenge for nurses and midwives to embed career in research. But also the other levels, other elements, the disparity in opportunities, the lack of research experience and training, lack of communication of clear plan with the line managers and head of nurses to embed and facilitate this process. And also often the deprioritization of research in clinical areas. So as you can see in these slides, so nationally now, we are very lucky because in the last few years, we had a recognition of how research wants to be embedded on national level, and this as a cascade also has been taken on board on trust and organization. So as you can see, Professor Joe Cooper, Alison Richardson's leading the CNO in England, and also Professor Jane Sandals from the midwife research. But also, most important, Ruth Handcott has been appointed as NIHR Director of Nursing and Research Midwifery. So a clear directorate now that really try to drive the next workforce in research. So the CNO England Strategic Plan for Research has been published and set up along with the 5 different pillars in how we underpin their vision and want to embed research in clinical areas. So we want to align nurse-led research with public need, realizing nurses' research potential, the fact that also nurses can be principal investigator, for instance, in research delivery, or building the best research system also. So we want to make England the best place for nurses-led research, nurses and midwife-led research, but also developing future research nurses, not just in the in research delivery focus, but also in the other field of research. And digitally embedded nurse-led research. Of course, in our trust, we see the taking over and the use of EPIC system, but also, the use of new technologies, AI is coming up, and the opportunity to lead new studies and be a forefront on this field. So in these slides, as you can see, the GSCT ACORN team has been created exactly to drive the workforce and try to facilitate this program. Led by Professor Susan Bench, Director of Nurses Midwife-led Research. Currently, we have a vacancy for the head of nurse and midwife-led research. But alongside me, also Naomi Haar, currently on maternity leave, research ACORN research matron. So we are trying to keep the network working, and also maintain high the communication between clinical areas and research departments, because we really would like to make research an everyday conversation with clinical teams. So what can we do? As you can see here, you can scan also with your phone the QR code. We would like to involve and gather more ideas. How can we do better? And we ask what can we do to help you to get involved in research. And this is one of the multiple activities that we run. In ACORN also we deliver different opportunity to get involved, but also become a research champions in your area, for instance. There is from Research the Cafe events run monthly. So this is an opportunity, informally opportunity on lunchtime to bring your mag and open up for conversation, research related. But also funding the evidence, improving skills in accessing high quality and relevant evidence. We run different workshops like the current workshop, but also the Writing for Publication workshop. We help to critical appraisal and engage clinical research midwife in research, but also open up for conversation and career progression. So there is also the option to submit for a free half an hour research one-to-one advice clinic, led by and run by Suzanne, the director of ACORN, but also Verna Lavander, head of cancer and research, or Holly Lovell from the midwife side. They can provide orientation and kind of open up the discussion about your career and what's the best next step for you to undertake your career and drive your career in research. So what did the pathway look like? So there is no standard to say. It really depends on the starting point, define the endpoint and time scale, but also depends about your clinical experience and background. And there is a different also a difference between training route and career pathway, and that's the why we suggest also a further conversation in the one-to-one research clinic, where you can book an appointment. Everything is available on the ACORN GTI page, so the opportunity also to book a slot, an available slot for further conversation. But in this session, I want to explore with you the different opportunities also and career pathway and academic pathway link with your role as a nurse and midwife. So the opportunity to undertake internship, pre-doctoral studies, doctoral studies, or post-doctoral studies really depends how and where you sit at the moment, but also how far you want to go and what goal you want to achieve. It's really important to define this vision of yourself, and also for a better understanding of what's the best pathway for you to undertake. Here in the slides, you can see there are different understanding of who is for in specific training. So if we look at the internship, we are looking for people that are new to research or they completed some pre-master level course, but they don't have a deep understanding of research. They want to explore more. A pre-doctoral level, you define, you have a time to define your research idea, and for a further, for future submission for a doctoral level. And the doctoral level, I always said, are not for everyone. The commitment is really high. You have to consider the time spending, how much you want to invest on it, because it really can be overwhelmed at time, and also really you have to keep your motivation very high, because at times it can be exhausting in a way. And postdoctoral level, of course, help to define what's the next step after a PhD as a senior level. So there are on each level of funding opportunities that are really interesting to explore and also to consider in case you want to apply, because this can be can be quite pricey, and sometimes, often, I have to say, people don't have the real commitment to engage financially to this. So fundings and the opportunity for funding are available at charity level, at trust level, and also the opportunity to apply for that and be granted. So I'm going to talk 1 minute about the internship program, just because Emmy, you don't know much about you. I think, Emmy is one of the alumni that undertook the program in the past. And GSCT has offered this as an opportunity also this year during starting in the middle of November. So cohort 3 has started, and the program has been shaped in a total amount of 142.5 hours over 9 months. And the program is defined and is designed through those sessions about the foundational principle in research practice. This also help to give a support in development of a research idea, and bring in the research idea on the interns and their previous background and experience, and also allocated some facilitator, some mentors, and with the aim to complete an e-portfolio of development, and also with the option to complete work-based learning modules at either level 6 or level 7 with one of the allied university, King's College and London South Bank in this case. And that's what the last intern say, a really great opportunity to deep into tools into research, or if you prefer, an opportunity to leap into the sea of clinical research academia. But also those sessions, access to expert advice and support re-on proposal, and actually doing the research competencies, this has enabled me to see the light about the path forward. Related to the next step after the internship, and then where we always encourage also the alumni to submit application after they define their own research proposal, but also from external candidate, the opportunity to apply for a pre-doctoral scheme. So this is linked in particular with the NIHR integrating clinical academic program, which is allowed the students or clinical staff to apply for a scheme that can be fully funding, and give the opportunity to undertake further research and cut down the idea of your findings and in a more structural application level. So the opportunity for funding to support the submission of a doctoral fellowship application, and that they undertake the program of an academic training at master level. So this will cover your salary, the fully funded salary, but also up to £5,000 for master level training, and up to £1,000 to cover the cost of attending conference and meeting fees, and also the cost of supervision and mentorship. Option 2 is related to a bridging scheme that offer to cover the salary up to £400 for formal courses and associated travel and substances, but also up to £500 to attending conference and meeting related, link with the program. So this is a small amount of is less than optional one standard option, but give you also some funding to help you to sustain the cost of this conference and fees, but also help you to give it the time in particular to shape and define what's the research proposal that you would like to submit for a PhD application. So this is a really good program, and I really suggest you to look on the NIHR portal because there are different intake through the year, and it's a really good opportunity for you and to think about what's the best step for a postgraduate to consider. So at the end of the PCAF award, the fellowship should be able to demonstrate development in academic career and also in a position to make a competitive application for a PhD fellowship. So you will have a completion of the training and development program, the preparation of the application for a competitive peer-reviewed doctoral level research. You will have the opportunity to increase research skill and develop also research interest and maintain clinical academic network. The pre-doctoral are both in either bridge and fully funded scheme, so will fund 20% of clinical time. The competition open annually in January, but also I'm aware that also late in the year the starting, and also take around we will take around 6 to 12 months to develop a really powerful application. So the suggestion also is to stay in touch with us. You can also submit and send an email to NM Research for the ACORN, to the ACORN Center, to stay in contact with us and define, have a further conversation about this opportunity. And we really could support you and have also defined better the way how to submit the application on a more structural level. So what's the next step for you? It's to look really into, well, first getting started, of course, but it really find your area of interest. Undertake a research training, of course, is always useful to look into the network and build a conversation about it, but also look in specific training, research training that you think are essential to define the next step for you. So develop your support network and seek for support and gather information. This is quite an essential step for you to define exactly what's the next step for you. And also start writing soon, having protecting time, have this conversation with your line manager and allow you to have this in place. And also I would suggest put add on your PDR objectives these elements that really help you to define the way that you would like to undertake your next step in career. So have a look also on your CV, writing the person profile, the place, and create like a project lens of your objectives. There are different relevant readings, also researches. You can have a look on the ECI program in particular. I don't know if I can. Yeah, apologize. Let me have a look if I can open up. No, this is another. I can show you here. This is the integrated clinical and practitioner academic program linked with the NIHR. So this is defined exactly the schemes available for you to undertake other internship scheme or pre-doctoral skill or DCAF, the doctoral clinical and practitioner academic fellowship. So what's the next step is well, looking around also different resources, but also stay in contact and keep the network active around you. So the key contacts are here. You can find on the GTI page the ACORN main web page. But also stay in contact with us, looking we are looking to supporting you, but also keep you updated with the next opportunities. So an opportunity also for you to follow us on Twitter, actually X now. But also to open up a conversation with you in specific and to define what's the next step. So with this in mind, I close the conversation and I will open up for any questions you have.